Dr. Berman may have found a big part of the answer to all the problems in healthcare with a new business called Slingshot Health, whose slogan is "Name your price for a doctor's appointment." Congratulations on the new business. Are any doctors going along with this?
Sure, and thank you for your time. And I am a small part of a rapidly growing team at Slingshot Health, and we have already hundreds of providers in Manhattan, not just traditional physicians, but also alternative medicine and complementary medicine providers on the platform.
Who will take patients on the patient's bid for service?
Yes. So we're a online dual-sided marketplace in healthcare. We understand that providers have on average 4 openings per day that go for naught. And at the same time, patients are waiting 30 days on average to see a provider. We give people accessibility, we make it affordable, and we give them transparency at the same time. And we do it regardless of their insurance disposition, their insurance status.
Well, how did you get this idea, and when did you get this idea?
So the idea popped into my head in my kitchen about 2 years ago. I was speaking with my son, Brian, who is very entrepreneurial himself, and he was talking about a one-sided marketplace in healthcare. And I had that aha moment.
That's me.
Yeah, no joke. It was, I started getting shakes. And I wish I had the back of that napkin. I kind of mapped out Slingshot Health in 2 minutes. And it really has not deviated much from that moment in time.
What did you map out? What did you write?
A dual-sided marketplace where you put providers in control and patients in control.
Two lines, two camps.
2 camps, a dual-sided, unfettered marketplace. So we bring that extra capacity of time that physicians don't use currently, 4 visits per day. We bring the fact that patients are waiting 30 days on average to see a provider. We bring those 2 together, and we do so in as an unfettered way as possible.
I sense that this is a larger mission of yours, but to keep it in business terms, it's as if the doctors are selling the last couple of seats on the plane before it takes off in the open appointments that day?
That's a very good analogy. On average, providers lose $100,000 to $150,000 a year in lost potential revenue from those 4 openings per day that go unused.
Will your service expand in any way beyond canceled appointments?
Sure. So because of these nuances and these advancements, such as electronic medical records, it used to be, and I've been practicing medicine for over 30 years, we would know, our office would know that a patient was going to take 15 minutes or 20 minutes or 30 minutes. But now we're forced into block times. So when you look backwards at a physician's schedule, there's about 17% open time, and when looking forward that same day, it's 4%. So it's that inefficiency, that efficiencies are supposed to be bringing forward to us, actually makes it harder for us to practice medicine.
You're the first one I've heard crunch numbers harder than Wall Street. Repeat that. Looking back, there's 17% of the time was open.
So when you look forward,
okay.
from 8 a.m. to 5 p.m.
I'm going to have 17% of my time.
You see 4%, 5% open.
Okay.
At the end of the day, looking backwards, you see about 70% was open at the end of the day.
Wow.
Right.
So they can take on more business. But now, don't the doctors now have to just share is the revenue theirs, or is it the hospital's now?
So we do it in a very unique way. When a patient joins us, they give us either a credit card, a debit card. They can use their HSA or FSA account, so that payment's in cash. So when the physician gets paid at the time of the appointment, it's a cash payment. So there's no worrying about balance billing, about EOBs, about administrative costs, about clawbacks, and all the other administrative necessities that are thrown at us by the government or insurance companies. I'm sure you've been to the doctor's office recently. We spend half of our time looking at computer screens and not the patient, checking off boxes that have nothing to do with that patient for that visit. With Slingshot Health, we free the provider from all those necessities of having to worry about collecting money.
The provider is the doctor.
Yes.
Yeah.
So worrying about having to collect that money, the costs associated with collecting the money, and all the other administrative nightmares that are related to that visit.
And the patient will pay and then get reimbursed by their insurance company or not, right?
It depends on which of 40,000 insurance plans that patient has, but they can submit that for their insurance company to be reimbursed. Yes.
It's up to them.
It's up to them and their insurance plan.
Right. So, so it's a lean operation because there's no bookkeeping. And it's up to the patient will decide whether they want this appointment today or later. They're presenting themselves. You're just providing the platform.
So over the last several decades, we've been taught that we need to beg for our health care that we need. What Slingshot Health does, it puts people back in control of their healthcare destinies, not just what you need, but what you want. If you want to see a physical therapist, or if you want an MRI, or if you want to see an internist for diabetic care, or a dentist for dental care, you're back in control. You tell us, and if you put in a Manhattan zip code today, we have over 60 different specialties that will pop up, 1,000 different services.
You went out and signed up all these doctors, or at least the first group of them. You went out and signed them? How'd you get these doctors?
Not me personally, but yes, our team
Your
did.
team
yes.
did.
And since we don't, there's no membership fee. We're free for patients. Right. When you join us, there's no service charge, there's no maintenance fees, and providers, in addition, it's no risk. So providers are very willing to come on board. There's nothing to lose. If they're busy, they don't have to accept a bid. If they're not busy, they can accept a bid. We tell the patient the average cost for that service that they're seeking. So when they put a Manhattan zip code in and they request a service from us, they tell us the date they want to be seen. They give us a time window in which they want to be seen. We will tell them an average price for that service. They use that as guidance. They then put their bid in, and that bid goes to all the providers that can perform that service for the patient. The provider then can either accept it, can counterbid, or ignore it.
I was going to ask you that.
Yeah.
There can be a bid back and forth a little bit.
Just one counterbid. So we don't want people nickel and diming people, right? And there is a seriousness to healthcare, right? The problem that we have is all these attempted fixes don't put the patient or the provider really in focus. So I've been practicing, again, medicine for 30 plus years, and every time I hear somebody has that next fix for healthcare, I start shaking a little bit, and all I know is that we're gonna get another acronym or two, another few $1 trillion in debt, less accessibility, less affordability, and at this point, zero transparency.
It's going the wrong way.
It's been going the wrong way for a long. That's why doctors are burning out, and that's why patients are afraid to enter the healthcare system.
When you say counterbid, the patient will offer $75. What would be a typical patient offer on a?
Well, it depends on their service.
I know it depends, but maybe $75 or $80 for a visit.
Sure.
And the doctor, by one counterbid, the doctor can say, "I'll do it for this." The patient cannot then bid back.
Right.
No.
But it goes out to all the providers.
Oh, it goes out to all of them, right?
Right. So so we've had an instance where there was a dental bid that was put out. We had 5 responses in under 5 minutes. Yeah. Because there are dentists that may have an opening for that time slot, right? And there may be somebody that doesn't, but is willing to counterbid. All we are is an unfettered, dual-sided marketplace in healthcare.
The more you talk about this, the more appealing it sounds. And simple and fair.
Thank you.
And the reason I picked up on the counterbid was there's a company, a new ride-hailing company, which is opened here in New York, which started in, of all places, Siberia. And they are starting a system where you bid for a ride. And the driver, now I don't know what aspects of highway safety are involved in this, but the driver can say, I'll accept your bid or not. And there's a limit, there's one back and forth, I think, by each party.
Sure.
But that seems to be a wise business model. You know, we're gonna have a deal or not here pretty quickly.
Well, there's different levels of providers. There could be somebody that's brand new into practice.
Right.
There could be somebody that's been practicing 30 years. Right? And there could be somebody that has a sudden opening in their schedule that wants to fill it. They may be willing to give you a discounted rate for that visit in an attempt to win you as a patient in perpetuity.
So could there become doctors who do their whole day through Slingshot Health? Look at that smile.
Yeah, I'm trying to do that myself. It brings back the joy into medicine. You know,
so maybe there might be some people who put their practice with you.
Sure.
And they become sole proprietors again.
Using Slingshot Health, sure. And why not, right? Because we put people back in control, providers and patients.
Did some friends or advisors who are, quote, experts in business help you set this all up? How did you pull all this together to this point?
So I've been very fortunate in life. I've been able to gather the ears of many people in many different walks of life, whether it be in healthcare or finance or almost any aspect of life. And I don't mind talking and listening. So it took a few months to get the messaging right, to get this. So the first initial responses were, okay, maybe, maybe, maybe. And
when
then,
you were talking with friends,
yes.
some physicians and some business people,
yes.
was that your group?
My first friend didn't like the idea so much.
Yeah, so find another friend.
Oh, I love him dearly, but what that told me wasn't that it didn't say that the idea was bad, it was my messaging was bad.
Correct.
Right? So once you understand how to fix that message and understand the audience that you're presenting that message to, because it's different to investors, it's different to providers, it's different to patients, it's different to insurance companies. Once I understand how to get that message across to people, the aha moment, it always was, oh my God, why hasn't anybody else thought about this?
That's fascinating because one of the smartest radio program directors I ever worked with, I just saw recently, used to tell us, the news reporters would say, I explained that story. And the listener didn't get it. And he said, you did not explain it because it wasn't the listener's fault. You did not explain it properly.
Right.
And that's what you found as you honed this message.
I think
it's not them, it's
always the entrepreneur, right? If the entrepreneur doesn't believe in their idea,
right,
then they won't get an opportunity to make that message correct. That no to the entrepreneur is not a no, your idea is not good. It's just, I don't understand that idea.
Yet.
And in healthcare, it's actually can be more complex.
Right.
My advantage is I've been living this for 30 plus years, so I understand the environment. Right. I understand the sandbox that I operate in. Right. I was able to get that messaging more honed for that audience. And once I did, I had friends just start handing me checks. You know, get this done because I don't like practicing medicine anymore.
You sold shares. They handed you checks for a stake in the business?
Sure. We just finished our seed round this past July.
Mainly from doctors?
No, mainly from investors.
From investors.
We were very fortunate. We have actually 2 billionaires in our seed round.
Wow. But are some doctors partners? Did they take a stake?
Yes. Right. Oh, yeah. And I think that helped the investors initially. Was to see that our initial wave of investors were all providers. It was part of that marketplace.